Hello and welcome to this special show. I'm Amrit Pal Singh. You're watching a special show, Fact versus Myth, on the situation arising out of the prevailing corona pandemic, which has gripped the world and also our country. Over the next 30 minutes, we'll be taking questions from you so that you can get accurate information about the coronavirus outbreak. To answer your queries, I have with me two special guests in the studio to bust the myths about the coronavirus and give you the facts so that you know what it takes to be safe without panicking and falling prey to the rumor mills. I have with me Dr. Sudhir Kumar Jain. He is the Additional Director of the National Center for Disease Control. And I also have with me Dr. Tanmay Talukta. He is the Head of Department of the Respiratory Medicine at the Lady Hardinge Medical College in Delhi. Our telephone lines are now open. The numbers are as follows. They are on your screens. There are 011 if you're calling from outside Delhi, prefix 011. The number is 2309-7663. Our other number is prefix 011 2338-6682 and 2309-7620. If you're calling from outside Delhi, don't forget to prefix 011. That's Delhi's code. I'll repeat the numbers: 2309-7663. The other number is 2338-6682 and our alternative number is 2309-7620. You can call on these numbers. These numbers are being flashed on your television sets right now. You can call in and take questions, ask your questions, clear your queries from the two doctors that I have with me in the studio right now. And if you're calling from outside India, prefix 0091 or +9111 and the numbers being flashed on your television sets right now. But before we get into talking to our guests, let's give you an update of what really is the latest situation as far as the coronavirus pandemic in our country is concerned. Dr. Harshvardhan, the Union Minister of Health and Family Welfare, today on Wednesday chaired a high-level review meeting with senior officials of the ministry, the medical superintendents and the directors of the central government hospitals such as Safdarjung RML Hospital and AIIMS in New Delhi. He held this meeting on Wednesday. At the outset, the Union Health Minister appreciated various actions being undertaken in close coordination with various ministries at the central level, states as well as Indian embassies abroad. He also lauded the states for their active surveillance, effective contact tracing and their preparedness for containment and management of COVID-19. He reviewed the preparedness regarding the hospital management such as OPDs, blocks, availability of testing kits, personal protective equipments, medicines and adequate isolation wards. He directed the hospitals to ensure adequate availability of protective gear for all healthcare workers. Dr. Harshvardhan reviewed in great detail the quarantine facilities for the evacuees, including the ones at the airports or the other key transit points in terms of segregation of passengers, transportation to quarantine facilities, health checkup, etc. And well, as of the Wednesday evening, let's tell you what the total number of coronavirus cases in India are. The cases have risen to 147. These are the numbers as of Wednesday evening. These include 25 foreign nationals. One case each has been recorded from Andhra Pradesh, Odisha, Punjab, Tamil Nadu, Uttarakhand and West Bengal. The total number of 14 persons have been cured and they have been discharged, while 3 deaths have been recorded till now. The highest number of 41 confirmed cases have been recorded from Maharashtra. The center has advised all ministries and departments to install thermal scanners at entry of government buildings as feasible and mandatorily place hand sanitizers at entry points. It has also been advised that the entry of visitors to office complexes must be discouraged to the maximum extent possible, and meetings must be held through video conferencing. So these are the advisories, and this is where the figures stand. 14 have been cured, 3 deaths so far, 147 are total people who are suspected to be infected, and these are the figures. All right, we have our first caller calling in, Mr. Raj. He's calling in from Mumbai. Mr. Raj, go ahead and ask your question, please.
Well, doctor, now what happens now? Usually we are traveling in the train and all, in the transport and all. So how we can prevent ourselves, like, no, it is a high risk for us. So when we don't know anyone, like, who's there, no, who's infected and all. So we just wanted to know how can we safety of this, like, for them, if you answer this question.
I could hear you very clearly, Mr. Raj. You said you asked that you travel in train, so how can you protect yourself from?
Yeah, because with the transport, public transport we are taking.
All right. So how to protect one while traveling on the public transport? Let me take this to Dr. Sudhir Kumar Jain. Dr. Jain, this is a very valid query that most people who use public transport and most people use mass transit systems in our country. How do they protect themselves?
Yeah, public transport, definitely some risk is there, but you need to know how to protect yourself when you are transporting. If somebody is coughing or sneezing and is standing nearby you, you should always politely ask that person that he should wear a mask. And the second thing which we always tell, that you should always wash your hand once you are out of this public transport. You should wash your hand with soap and water, and so that there is no germ left on your hands, and it should be clear. And as far as possible, one should avoid traveling, as we are always saying that you try to work from home. We are discouraging people to move, and all the school, colleges, offices have been asked to closed. Offices, private offices, we have asked that they can work from home, and in government offices also we have asked that people should not come to the office, to the government's buildings unnecessarily. So only necessary travel will be is advisable, and one should maintain a safe distance from anybody who is coughing or sneezing, and take your precautions accordingly.
Dr. Tanmay Talukdar, let me bring you in. As Dr. Jain was saying, use masks one. Yourself use a mask, and if somebody who's not wearing a mask is coughing or sneezing, to politely request them to wear a mask. And this is the objective of this show, to spread awareness that people should use masks, because prevention in this case is the biggest benefit you can have. The cure could, before it's detected, could be long, and then the cure could be long. It could be expensive, though the mortality rate is not much. But what sort of masks, Dr. Talukdar, should we use? I use a mass transport system. I live in Gurgaon. I travel by metro to Delhi. I've seen people use these, flimsy green masks that we generally see in movies as doctors using them. But what sort of masks should people use, which are actually effective?
Well, a very valid question. But first, I'd like to begin by clarifying who requires the mask.
Okay.
The common citizen of India who does not have symptoms need not wear mask.
Okay.
The requirement of mask is very selective, and I'll come to that. So the common person will have to do the same prevention of hand hygiene, keeping distance, at what we call the social distancing, as Dr. Saab just said. But now the question was pertaining to mask. So what we have to be careful about is the mask has to be worn by only those people who have symptoms of cough, breathlessness, or even cough or sneezing, running nose. So if you are symptomatic, you wear mask. Apart from that, if you're taking care of somebody who has the symptoms, then, or if you're visiting a healthcare facility, apart from that, obviously the medical professionals have different guidelines when to and how to use mask.
Right.
But for the common people, only when there is symptom, you have to wear mask. That is the first clarification. Second question which you said was, which mask do I wear?
But I want to stop you here, Dr. Talukdar. You said that if I do not have symptoms, I do not require to wear a mask. But as Dr. Jain was saying, say if I'm traveling in the metro, somebody else is sneezing, I don't know whether he is infected or not. So should I not, in my own interest, in my own protective interest, wear a mask?
Very good question. Again, the answer was given by Dr. Jain himself, that instead of the other people wearing mask, it would be prudent for the symptomatic person to wear the mask at his end. For that, I have to clarify how the disease spreads. You know, this disease spreads as a form of droplet. That is, when we are speaking or when we are coughing, that droplet of water with the virus comes out. So if we are able to stop it at the source, so that will happen only when the patient or the person who is symptomatic would be wearing it. Okay, for us or the other people around him, the better protection is to be away from the fomites or those droplets coming into our body.
Okay.
But again, to your question, if somebody has to wear mask, which one should he wear? And the answer to that question would be the simple triple layer mask. Here I would be again insisting on this simple triple layer mask is because people are going on for those most expensive masks which are called N95 that is not required for common people. It is the simple surgical triple layer mask. And more importantly, I'm sure subsequently we'll answer this question also, how to wear this mask. People are buying masks, they're wearing it, but
there's a proper way to wear the mask.
Definitely, there's a proper way of wearing and also opening the mask.
All right. We'll get into that, Dr. Talukdar, and it's very important that you say that N95 masks are not really required. Simple triple layer masks are required. That is something, say, for example, I didn't even know before I came to the studio. We'll talk more about that. We have another caller, Sridhar, joining us. Sridhar, where are you calling us from and what is your question, please? Go ahead and ask.
I'm Sridhar and I'm from Telangana state, which is city in Hyderabad.
Okay, yeah.
I have two queries regarding this COVID-19. One is question, I have two children and one is 4 years and one is 13 months baby.
Okay.
So what kind of precaution do we need to maintain for the kids?
You have a 4-year-old baby and a 13-month-old baby.
Yes.
And what precautions should you take to protect these little children from contracting, say, coronavirus?
Exactly. And that is my first query. And second query, I am a private employee working in a private industry.
Okay.
So if any person infected by this COVID, and even though he is wearing that mask, so how could I recognize that actual bacteria which is surrounding him? So do we any kind of recognize that actual bacteria and he is infected truly by this COVID?
All right. Dr. Jain, would you like to take this question?
Your first question is about your precaution you have to take about your children. So, best would be that you do not allow, since the schools and all creches and
I'm sure his 4-year-old and 13-month-year-old doesn't go to a school.
And the smaller, the little one is not going to the school. So, keep them at home, don't take them out very often unless it is very essential. And whenever you are touching them or somebody else is touching the younger kid, they should wash their hand. One should not just come out from outside, anybody is coming and taking the child in his hand or in her hand, and they should first wash their hand with soap and water and then only touch the child. So, if you protect your children like this and minimize your outings, because with children, if you most of the time what the parents do is that now the schools are off, they will go to movie, they will try to go to some relative or some other places. So, the schools have been closed so that children can remain at home.
Crowded places, that's what you're saying.
Yeah. Okay. So, remain at your home maximum and try to touch your child only after washing your hands.
All right. Dr. Talukdar, would you like to take the other question that he said, that how does he recognize that a particular bacteria, how does he tell a corona bacteria, though it's difficult to say that how can you tell a bacteria?
One, it's a difficult question. Two, there's a clarification. Corona, as Dr. Jain sir is reminding us, it's a virus, it's not a bacteria. Two, unfortunately or fortunately, the symptoms of corona is almost like the common cold or seasonal flu which happens during this change of season all over the country. So, to give a specific answer to the question, are there any symptoms by which you can specifically pinpoint this patient is having corona? No, that is difficult. But the general symptoms are there: cough, with fever, with breathlessness, with sneezing, with sore throat. But this can happen in myriad of other diseases. So, again, we'll come back to the point that it is the prevention which we have to do. We have to consider every case. Every person who is symptomatic around us, we have to maintain the safe distance of 1 meter. We request them or insist them on wearing a mask. If we ourselves are symptomatic, then our responsibility becomes much more. It's time that we citizens play our role, which we have always been playing, but more responsible role of not coughing in public, using a tissue when we are coughing. And if the tissue is not there, then cough on the fold of the sleeve of our elbow. In fact, something like this. So this is a better way of coughing. So
But why-
these protection we have to do.
Dr. Talukdar, why, as you showed us, that cough into your elbow or your sleeve, why do that? I mean, of course, don't cough otherwise, but say, why is it better than coughing into, say, a napkin or something?
And that question is for me?
Yes.
Yeah. See, usually our normal response of coughing is something like this. We cough on our hands, is it not? Or we use two hands. But then subsequently this hand becomes source of
Infected.
infection and we keep touching around. But this area, it has been seen over the years, is touched much less. So we cough here, go home, open the cloth and it goes for washing. So the chance of our giving this infection to others become much less. But then tissue is again better. We cough on a tissue and dispose it in a covered bin. So disposable tissue. So that definitely is recommended.
All right. Remember, you know, the idea is not to panic. Yes, it's a widespread disease. In many countries, it's been fatal. Italy, Iran, China. In our country, thankfully, the strain is not reached. In Kerala, they are seeing it could reach stage 3, but the strain is much lesser as of now. But the idea is to prevent it than looking at the cure. And that you can do by maintaining basic hygiene. Don't get scared, don't panic. It's not a, it is a pandemic. The WHO has called it a pandemic. It could get into mega proportions, but the way to stop it is not to get panic, not to overreact, but to actually maintain hygiene and prevent it. We'll show you how to wash your hands, and there's a particular way you can wash your hands where you can minimize the danger of actually contracting this and passing on this disease from the others. I request my producer to please play this first. He tells me we have a caller from Assam. We'll go to him, but if we can show this first, how to wash your hands to minimize the danger.
ही यूज़ करिए जब आपके पास साबुन और पानी का एक्सेस ना हो, जब आप पब्लिक स्पेस में हो, जब आप बाहर हो, आपको लगता है कोई आप से टच कर गया है जिसको खांसी है, तब आप हैंड सैनिटाइज़र का यूज़ करें, या इमरजेंसी में आप घर पे अगर कोई ऐसी बात है तब यूज़ करें. आप प्रेफर करें साबुन और पानी को हैंड सैनिटाइज़र के ऊपर. स्टैंडर्ड साबुन यूज़ करें. एंटीबैक्टीरियल साबुन से कुछ नहीं होगा. आप कोई साबुन जिससे आर पार दिखता है उसको प्रेफर करें, जिसमें केमिकल कम से कम हो, कोई खास परफ्यूम या स्मेल ना हो, तो ज़्यादा अच्छा है क्योंकि आपको ज़्यादा हाथ धोने हैं.
Okay, we have our next caller. He's calling in from Assam. If I get his name right, Mr. Bhisham. Am I getting your name right? Tell me where in Assam are you calling from, and please ask your question.
Hello.
First of all, please tell me your name and tell me where are you calling from.
Sir, I am from Assam. My name is Sri Vismalovital.
Okay. Please ask your question. Go ahead.
I want to know, sir, whether COVID-19 is spread from poultry like broiler and chicken, etc.
Okay. You want to know whether it's spread from poultry or live stock?
Yes, sir.
Dr. Jain, Dr. Talukdar, both of you, does it spread from that, or is it a virus which goes from sneezing and coughing?
Yeah, it does, Mr. Bhisham, it does not spread from any chicken, poultry or any pet also. Only thing is that you should, as we always say, that whenever you are eating some chicken or meat, it should be well cooked. So that precaution you have to take. And similarly, while handling your pets also, just wash your hand after handling your pets. It will not spread the disease. The disease will spread only from an infected person. If somebody is coughing, sneezing near you, he is going to spread the disease. Otherwise, from animals, it is not spreading in India.
Okay. You saying animals don't contract it.
Yeah.
If I have my dog at home, so if I'm coughing and sneezing, my dog wouldn't catch coronavirus.
Yeah.
Is that so, Dr. Talukdar?
See, these viruses very rarely jump species. You know, it happened in Wuhan, from some unknown species. We are not very sure whether it is bat or some other intermediate host. It came into humans. But now the disease is traveling from human to human.
Okay.
So you need not worry about you giving your corona to your pets. Please keep loving them. But I'll again insist, having touched your pet, it is very imperative that we wash our hands before we move on to next activity.
All right. We have another caller. We have Mr. Kailash. He's joining us from Bilaspur. He's calling in from Bilaspur. Mr. Kailash, please go ahead and ask your question.
Hello.
Ji.
Sir, my question to Mr. Talukdarji and Mr. Jain is that I'm calling from Bilaspur, Chhattisgarh.
Ji.
In fact, there is no coronavirus impact here at Bilaspur. But I have a specific query. As being told, the temperature, with a higher temperature, the coronavirus does not affect.
Oh.
So,
okay.
please tell me this. I want to answer for this, sir.
Yes, Dr. Jain and Dr. Talukdar, please clarify. They said that India is a tropical country. Once it reaches about 35 degrees, the virus can't survive. How much truth is there in that fact? In that statement or information?
Yeah, we are also hearing this type of news from many sources. But so far as our various scientific studies or evidence are concerned, we do not know whether this 35 degree or 30 degree will kill the temperature or of temperature will help us in stopping the spread of the disease. So, we have to be vigilant, we have to be careful. We don't have to be like now the summer is coming, it will be 35, 40 degree temperature, which we cannot take that it will not spread.
No studies prove that it cannot survive at those temperatures, the virus?
No, it may, that depends on, in the environment it may not survive, like on surface, on surface it will survive for some time. But we do not know whether in our body, which is already 37 degree, and it is surviving and it is multiplying and it is passing on to other people. So, it will not, we cannot say now at the moment that whether the temperature will have any effect during the summer, but again all our precautions, all our measures, coughing, etc., as we have told earlier, you have to take care of those things. You have to wash your hand, you have to use
hygiene.
Respiratory coughing etiquettes, etc., so that disease does not spread. Temperature may not have much role.
Okay, may not have much role.
Yeah.
Dr. Talukdar, do the studies say that they do not have, the temperature does not have a role? Not studies enough to say that we don't know, as the scientific community does not know as of now, that will temperature have a role or not?
No, his question was very specific. Summer is around the corner. Can we be confident that this virus will go away? Answer to that question is we are not very sure, because this is a new virus. And to give you example, Singapore and Australia and certain other countries where the temperature is higher than what it is here, and the virus is thriving. So, we can't rest on the fact that temperature will rise and will get better, but prevention, and again I will insist on prevention of cough etiquette and hand hygiene is how we are going to win over this war.
We will crack this. All right, we have another caller. We have Mr. Sachin. He's calling us from Jharkhand. Sachin, go ahead and ask your question, please. Sachin, can you hear me? Please ask your question.
Hello?
Yes, please go ahead and ask your question.
Sir, can I change my language?
Sorry?
क्या हम हिंदी बात कर सकते हैं
जी जी बिल्कुल, आप हिंदी में बोले जी, अपना सवाल पूछें
जी। क्वेश्चन मेरी माँ के लिए है। मेरी माँ क्वेश्चन कर रही थी, जो ये बोलती है कि ये पोल्ट्री के जो चिकन होते हैं या जो उड़ते हैं काले में चमगादड़, उनके खाने से ये फैल रहा है, तो क्या ये राइट है?
जी, ये सवाल किसी ने अभी भी हमसे पूछा था। मैं चाहूँगा कि मेरे जो दोनों गेस्ट हैं, डॉक्टर जैन और डॉक्टर तालुकदार, एक बार फिर हमारे व्यूअर्स के लिए क्लैरिफाई कर दें कि क्या पोल्ट्री या चिकन या मीट खाने से ये ज़्यादा फैलता है, क्योंकि ये सवाल बड़ा आम पूछा जाता है दैट इज़ नॉन वेज, शुड नॉन वेजिटेरियन बी फूड बी अवॉइडेड, इज इट स्प्रेडिंग थ्रू दैट? डॉक्टर तालुकदार?
नहीं, ये बिल्कुल भ्रम है जी। ये मैं आपको दोबारा बताना चाहूँगा कि अभी इंसान से इंसान में ये बीमारी फैल रही है, जानवरों से अभी हिंदुस्तान में ये बीमारी नहीं फैल रही, तो वो उस पर निश्चिंत रहें। आप अंडा या पोल्ट्री, मछली आराम से ले सकते हैं। फिर से हम लोगों ने जैसे अंग्रेज़ी में भी बताया था कि धो के स्वच्छता मेंटेन करनी है, अच्छे से धो के पोल्ट्री का इस्तेमाल करना है, और कुकिंग भी अच्छा उपयुक्त टेम्परेचर में उसको पूरा बना के फिर खाना है। इसका ज़रूर हमें ध्यान रखना है, वरना पोल्ट्री से ये बीमारी फैलने का अभी कोई सबूत नहीं है। आप निश्चिंत रहें, पोल्ट्री आप आराम से ले सकते हैं।
So it's pretty clear that non-vegetarian food is not causing the spread of the virus if you're cooking it properly, if you are if it is hygienic, if you're maintaining cleanliness, there is no problem in consuming non-vegetarian food. The virus does not spread through that. The virus is spreading from humans to humans, and it's a respiratory virus which is having an effect on your respiratory system. It is spreading through coughing, sneezing. So basically you need to avoid that. Try and not go out into public. If you go out into public, use a mask, or if you do not have a mask, use a mask if you are infected. Otherwise, cough into your handkerchief or tissue papers, or if you still are not carrying that, cough into your sleeve or into your elbow, as my guests in the studio, Dr. Talukdar and Dr. Jan, were explaining. And these are, wash your hands, sanitize your hands, wash them properly, and this is what you need to maintain. Dr. Jain and Dr. Talukdar, many thanks for being on the show and clarifying the queries of people. I hope this program was of use to you, and you learned from it. Bollywood actor Amitabh Bachchan has shared a video where he talks about do's and don'ts about coronavirus. We'll leave you with that. That's it in the show from me. Thanks for watching, listening to Amitabh Bachchan.
नमस्कार, मैं हूं अमिताभ बच्चन। देखिए, हम सब मिलकर नोवल कोरोना वायरस या कोविड-19 को फैलने से रोक सकते हैं। इसके लिए हमें बचाव के कुछ तरीके अपनाने होंगे। खांसते या छींकते समय हमेशा अपने मुंह को रुमाल से या टिश्यू से ढकें। इस्तेमाल किए हुए टिश्यू को तुरंत ढक्कनदार कचरे के डब्बे में डाल दें। अपनी आंख, नाक और मुंह को हाथ से न छुएं। आप अपने हाथों को समय समय पर साबुन और पानी से लगभग 20 सेकंड तक धोएं। भीड़ भाड़ वाली जगह पर जाने से बचें। अगर आपको खांसी, बुखार या सांस लेने में तकलीफ हो रही है, तो आप दूसरों से दूरी बनाए रखें। ऐसे लक्षण दिखने पर तुरंत अपने डॉक्टर से सलाह लें। अस्पताल में आप अपने मुंह पर मास्क या रुमाल जरूर रखें। अधिक जानकारी के लिए स्वास्थ्य एवं परिवार कल्याण मंत्रालय की एक हेल्पलाइन है 011-239-78046। अपनी सुरक्षा के लिए हमारी मदद कीजिए।